Thank you to Miles Briggs for securing this important debate today ahead of Love Your Lungs Week, which takes place next week. And thank you to Chest Heart Stroke Scotland, Cancer Research UK and the British Lung Foundation for their briefings, but as Miles Briggs touched on, for all the work that they do all year round. I was pleased to sponsor the British Lung Foundation's event in Parliament last month, which really focused on research and innovation, and the Minister was also in attendance. So I'm struck by what Emma Harper said about her sister and the important work that she's doing. So there's a lot there that's really positive and really dynamic. But I'm also today pleased to be the sponsor of the event that's taken place in the Parliament's gym, and that's with Chest, Heart and Stroke Scotland on pulmonary rehab. And that does explain why we're all a little bit breathless as we arrive today. But again, I think it does emphasise the fact that on these issues, we do come together and we are working from different parties on issues which affect so many people across Scotland. So again, I would pay tribute to Emma Harper for the work that she leads on through the cross-party group on lung health. It's really important. Others have mentioned COPD. We know that self-management for conditions like that are critical to living well and for as long as possible. Yet Chest, Heart Stroke Scotland estimate there is a significant level of unmet need for pulmonary rehab. And we've just come from the gym and we've heard the difference that it's making to people's lives. Currently, capacity is for less than 6,000 people in Scotland, but almost 70,000 people are living with COPD who could benefit. Chest, Heart Stroke Scotland say that an investment of 1.47 million, so we're not talking about huge sums of money, but that would double the current capacity of rehab programmes from around 5,600 people to around 10,500 people. So this seems like a relatively small investment for such great rewards that would benefit so many people. And I'd be grateful to hear when the Minister speaks today what he thinks about the event today and what the government is going to do. We've heard some alarming statistics. Lung cancer is the biggest single cause of death in Scotland, and lung disease is responsible for 700,000 hospital admissions across the UK every year. And behind all these figures are people, families, friends affected by poor lung health. One of my grands sadly died of lung cancer. She was a smoker, but she also spent much of her adult life working in pubs, sort of working men's clubs, and inhaling other people's smoke as well. And as we know, this year we are celebrating and reflecting on 20 years of the Scottish Parliament. And I think the policy or achievement that's come up the most is the legislation around banning smoking in public places. And for me, that is one of the most ambitious policies this Parliament has pursued, and it's transformed workplaces and the places where we socialise. So we know what can happen when the Parliament is focused, is bold and is ambitious. And I would say that we must apply that same ambition to other measures to improve respiratory health. The development of a respiratory action or care action plan for Scotland is vital to translate research priorities into real benefits for patients. I think there has been some concern that engagement, that progress has been slow. So again, hopefully the Minister can give us an update. But I think we are, Presiding Officer, really blessed to have fantastic organisations who make sure that we are raising the issues, that we are champions for these issues, but also give people with lived experience an opportunity to have their voices heard, their experiences heard, to be able to persuade people like us to get into the Parliament gym. Although we were in our kind of working clothes here, our suits and our heels in my case, I think we need to get back there and do a proper workout. But it's really, really important that we continue to engage with all these organisations. I know that Chest, Heart Stroke Scotland are not talking about a huge amount of investment, but it would make a big difference. And that's the kind of difference that I know we can make if we keep working together. Thank you.